Morning, Greg. How you doing?
Doing fine. How are you, Joe?
Pretty good. Morning, Alia.
Good morning.
Hi, Morgan. David with the Merraine group just let us know that his internet is going in and out, so he's moving to a new location and should hop on in a minute. Oh, you're on mute, Morgan.
Sorry, I said I'd say that I'm a couple minutes late. Sorry. Just running from one thing to the next here.
Hi, Brooke. Just wanted to let you know David's internet was going out, so he's moving locations and should join us soon.
Okay, I am on my phone because I am out and about.
Okay, I got another email from David. He says that Teams is giving his trouble. He's going to try one more time, and then if he can't log in, he'll call from his phone. Hi, David.
Hi.
You want us
Hi.
to go around and do introductions really quick? Would that be helpful?
Yeah, and I really I don't see anyone on the screen. Is that
Starting to pop up a little bit.
okay? I see names. I just don't see any faces yet. My apologies to everybody who took time out of their day for this. This was I had to change locations, and for some reason my Teams wouldn't work, and so I'm signing in from the browser.
No worries. So if we'll start with maybe Greg, Thomas, and then go to the rest of the board members, and then we'll do BCPH staff.
Excellent.
Good morning, everybody. Greg Thomas, Board President.
Hi, David. Thanks for putting this together. I'm
Sure.
Morgan McMillan. I'm the board vice president.
Yes, we've met.
And I know Brooke's on her phone, so she might not be able to come off mute. So, oh, there she is.
Yeah, Brooke Harrison, board member.
Hi, Brooke.
I can jump right in. Good morning. My name is Elia Barraza. I use she, her pronouns, and I am the Community Health Program Manager at Boulder County Public Health.
Thank you. Good morning.
Good morning, David. My name is Joe Malinowski. I serve as the Environmental Health Division Manager at Boulder County Public Health.
Good morning.
All right. I think that's everybody, David, if you want to go ahead and get started.
Sure. So I think what we'll do is I'll start with I've already sent over the 8 presentations who to us kind of rose to the top. I did it the best of my abilities to blind who the people are. Anyone who goes on Google, you can probably figure out who some of them are. But I tried to give a few different bests, a few different people. There were some people who are just a shoe-in. You walk right into this role and they can do this kind of with their eyes closed almost. No one can do this with their eyes closed, but they're ready. Some people have certain promise, which may not have been realized in the past, but perhaps Boulder is the right thing for them. And some people have a very strong dedication to Boulder County, and we can work with that. And I want to leave that up to you to decide who you thought were the best and where you thought the best fits would be. Ultimately, this is going to be a meeting of who you want and who wants you. And so if you were to choose only people who you all wanted, but I thought maybe were kind of a stretch to get, I would let you know that. No one that has been presented here of these 8 is a stretch in the sense that everyone is genuinely interested, is going to interview. I reserve that for if the people who were exactly in line with what you were looking for and would be a perfect match, if somehow those got sidelined, I'd just let you know. I've already put a lot of writing into this, so I expect you're probably bored of hearing and reading them. I don't know if you followed. I don't know how you split it up. Did you each review the applications individually? Did you take some and some? How did you do it?
Individually, I think.
Okay.
Yeah, David, we were hoping to kind of hear maybe some overview from you today. And I know you've included your notes, and maybe we can all ask some questions. And then we have a subcommittee and then a board meeting to actually go through the candidates that you've presented. So
Okay.
we haven't had those discussions yet.
Okay. So I guess let's just go in order 1 through 8. And by the way, the numbers 1 do not necessarily reflect, a prime candidate. They're just randomly selected. I think the easiest thing for me to do then is to just get them on my screen. I'll walk through each one, tell you what I thought. Some of it's going to be repetitive. I've already written about it. And if you've reviewed them and you've had any questions, let's go with that. So just give me a second. I'm going to get it open on my screen. All right, let's start with one. Okay, so in no particular reason why this person is candidate number one. The first, I looked at one thing, you'll see this on the bottom. Anyone who was a physician in a certain way got, particular credit, because I think the county needs that, and you can continue hiring out, but if you have somebody who's a physician as well. This individual, what I liked about them was their passion to, not passion, they're very passionate, but what's guided them thus far has been a mission of public health. They've been offered to do other area. They've been offered other areas. They've always chosen what has followed to them to be a mission of public health, of helping those who are in need. Sometimes when you see Kingdom of Saudi Arabia, you think, oh, they went to work for the rich oil people. That's a misnomer about Saudi Arabia. It's also a misnomer about any area. It is 1 or 2% of the population are very wealthy. The bulk of who this person had to educate and advocate for were people who had no access to service, very little access to education, and this person had to really influence their public health system to make differences for the greater population. I'm talking about HIV education, things that some of us may even take for granted. They started off New York, New Jersey, worked with a mission-driven agency there, then moved to Saudi Arabia, moved back. They're in Florida now, but it was only a 2-year contract with Lee Memorial, and they're looking for the next right thing. I put a specific concern there, which I'm happy to address, but before I do that, were there any specific questions that you all had regarding this first candidate? Okay.
I think
I-
I was just a little, why do you think that this person has enough experience? Because our really big concern after our last hiring round was we don't want to end up with another person that doesn't have the right amount of experience at this level.
So when you ask the right amount of experience, are you talking specifically within county leadership or within leadership in general?
I'm talking with a high level leadership role in public health where they would have to deal across a lot of different departments, a lot of different concerns.
Right. So that has been it was not in this country, but that was their role in Riyadh.
Okay.
They were the public health director for 6 years.
Yeah, I think
And
I'm concerned because none of it is in the US.
so, right, I did point that out. That specific was not in the U.S. Their work in the United States was not county work, but it was with a health system, with Catholic Health, in New Jersey. Again, if we're going to look at like someone who's on the ideal side, this is more somebody who's ideals. We're going to also have candidates who this is what they've done the whole time, is county government leadership. You'll see those candidates as well. But this is someone who almost leads from what their experience has been, even if it hasn't been exactly this.
Brooke, did you have any other follow-up questions on that? Or I have a question about something else in the notes, David. So you mentioned the person identifies as a person of color, but does not see themselves as a victim of racism. So can you tell me about how that came into your conversation? I haven't had a chance to read through all of the answers to their questions yet, but it's a flag.
Okay, sure. When you read through the question, you will see one of the questions is specifically addressing this. And this candidate answered that they have never experienced racism, or maybe one small incident. And this person definitely from other people's lenses has experienced it. And so I asked them, why is it that people who look like you and have reported to me that they've experienced it in so many ways, why do you say that you haven't? And that's when they described that I see people, I'm just going to quote him, I see people as people. I have seen people of different faiths talk to me about my faith and expect certain things based on my faith. And every time I've gotten to know people better, I've seen that it's always been a misunderstanding. I have not found, this is their words, I guess I'm giving away his gender, but I've not found that there's something institutional. I found it personal. And I have always found that it's been something, I have colleagues who've looked at it differently and they've seen it the way they see it. I see it the way I see it. So, you know, is that a flag? Maybe. It's I value their own experience and I value the way they look at it, despite the fact that I think on a surface level, they've been exposed to a whole lot of institutional racism. I don't think they had the same chances I had, for example.
But they don't acknowledge institutional racism. Is that what you're in
I wouldn't
conversation
say
with?
that. I wouldn't
Okay.
say that. They don't acknowledge it for themselves.
Okay,
They
but
would
they might acknowledge the existence of institutional racism.
I wouldn't say they might. I think they very clearly agree that there is.
Okay. I appreciate that clarification because that's I would think a big issue for for this department. So and I know we're not here to like eliminate candidates or talk through candidates. That was just a point of
We can.
clarification. I appreciate you
We
talking
can
through it.
eliminate candidates.
Well, I think we have separate meetings set up to have
Okay.
that discussion. So I don't think that's part of the agenda for today, but just to clarify some points
Okay.
is helpful. Thank you.
Sure. And so I don't plan to have solved any concern, but I hope I've addressed the concern about their experience. It's a little different and notedly so. Any other questions about the first candidate?
I think the first candidate also, didn't they? I'm sorry, I don't have my notes yet.
Mhm.
Didn't the first candidate also note that they have not been to Boulder? Is
That is
that
correct. That is correct. Yes.
Thank I just couldn't remember. Thank you.
Yeah. Good memory. Those are the kinds of things, if you look in the matrix, I've also like, those are things I've set out. If someone, it's about their motivation. You know, you could be very motivated, but maybe when you see it, I can't imagine somebody seeing Boulder and not wanting to move there, but it is something to be aware of. Do we have any other questions that we want to discuss about the first candidate? I will move along then. Okay. I'm sorry, I always familiarize myself with who they are for a second. All right, so the second candidate, in many ways, all right, I'm going to mess up a bunch of times with the gender. Sorry. They are someone who would be more on the shoe-in kind of. This is somebody who's done this job, has been in this role for the right reason, has been in a similar job, smaller department on this for this person, but a very similar job, knows Boulder, has been to Boulder, wants specifically to move to that area, only because the place they're in right now, they're young, and the place they're in right now is a older population. They do not have much of a personal life based on where they are, and they like to explore that part of their life. This is not a professional reason. There's not a professional reason to leave. It's more of a personal reason why they're looking. Their alignment with what Boulder stands for, both the public health department and a lot of what they've known about Boulder is right in line with what they've done. I think I also noted their reason for going into public health was being on the other side of it, someone who had less access to public health as a child because of being in a low-income family, and they were out of the suburbs, and they did not have the same as their friends who did not come from divorced homes.
I've got a clarification question.
Please.
In your summary notes on that first slide, you say that they're looking for a lifestyle change and a move to a more homogeneous county. Tell me more about that, please.
Sure. So I wasn't going to write this in an email about age. I wanted, it was just their lifestyle and the pool of people that they would hang out with are senior by about 20 years. That is not a statement that should mean anything. People can hang out with people 20 years older than them, but that's not what this person's looking for. This was not about a specific outlook on life kind of thing.
Got it. So it is not about, I guess when I read that, I thought like they want to move to Boulder County because we're so white. That's what I read when you said a more homogeneous county. They did not say that.
No.
Got it. Great. Thank you for clarifying.
Oh, wow.
And,
Thank you for asking. And that's so funny when you try to when you try to protect someone from sounding like they're being discriminatory, and then you end up sounding more discriminatory. Okay. Thank you.
Yeah, thank you.
I really did mean in lifestyle. And if actually, Morgan, if that's something that you think others would read that way, then I'd rather correct that before we.
Did anyone else read it that way? Is it just me? No.
Okay. My assistant Chris thought it would read as someone. You also did, okay.
I kind of thought the same, similar, but then I thought it was ridiculous somebody would put that in there.
I also was like, oh, huge flag. What is that in there?
I'm sorry. It never even dawned on me that somebody would say such a thing, let alone that I would write it. So.
I had mentally eliminated that person, so I'm glad I asked.
Jeez. Oh man. Okay. I'm going to change that then, because my assistant thought it read that you might think this person's coming from like a really red county and just wants to be in a more liberal environment. And so, wow, the power of communication. I'm going to change that then. Thank you for clarifying that. Anything else that we wanted to clarify about candidate 2?
I've got a question. So I think you said they're have really worked in settings on like smaller scale agencies. Mm-hmm. Is there anything that came up throughout the interview that you feel concerned with as far as like Boulder County Public Health being a larger agency? And I was just looking at some of the, I think, was it 70 staff members? I mean, was there any red flags that you say like, this might be a very big agency and trying to manage this big budget and trying to manage like, over a couple hundred staff?
No, I appreciate the question, and I appreciate that it's something that when we interview, if he's one of the people that we're going to be interviewing, I think it's important that that's something that is spoken about. But no, they're a strong administrator, somebody who good with convictions, but knows how to talk to people, knows politics. So no, I did not have a concern about that, but it's like I call it, it's something that needs to be addressed. There are some who didn't make it through the screening for exactly this, like the extent of what they've done was they've run 60 people. And when you talk about their leadership, there's something missing. I didn't find that with this person. Thank you for these questions. Okay, I will move along unless there's another question about candidate 2. Okay. Candidate 3 is awesome. So I don't know, just by looking at their profile, if you know who this person is, you may. And so this person's a medical doctor, currently runs a clinic in Colorado, but has a long story. They had run I don't even want to say it's successful hospital in Mexico, because that would be the wrong way of saying it. They changed their training is as an OBGYN, and if you look through the questionnaire, you'll see some of the things there. This person changed outcomes for maternal care. Sometimes we forget what other countries have, how tough some of their healthcare was. And this person literally changed a hospital around. They were subsequently a refugee from angering the wrong person by running a good hospital. I asked them, and I asked one of their references, how in the world they get this job. That person should not have gotten the job. It was a fix for somebody else. Person ran a very successful hospital, had to leave town. The person was kidnapped, taken away by the cartel, had to came through Canada and immigrated to the United States. Does not practice OB, is not certified in OB anymore, but now practices primary care. But this person has used their influence in understanding the Latinx culture to publicize. They worked as a volunteer for Colorado Health to help publicize public health risks, specifically with regard to COVID-19. They run a radio show right now. Dynamic individuals, how I would describe them, but not in the flashy sense, in the heart sense. Somebody who just has a very big heart, wants to see the world a better place, and has had every reason to stop, but continues. Knows Boulder County well, knows some of what's transpired over the last year and a half. And I thought specifically with the physician background could be a really good candidate. I guess I'll add this in case somebody's gonna ask this. The one note, this goes back to something similar to the candidate one. This person has not served as a executive director of a county public health yet. They've done, I think, more tough jobs and worked in tougher environments, but has not done this specific role yet. And so I wouldn't say that person's not a candidate, but I would think that requires just more sensible when the questions are asked in the interviews, just to make sure that the same language is being used.
I'm just curious because I think one of their answers was about how large groups can sometimes fail because of their size and lack of funding.
Mm-hmm.
This sounds like a person that might prefer to be able to make a lot of real actionable change through a smaller organization. Do you think this person would be frustrated because as an executive director, you don't actually get to drive a ton of change on your own? Things are very, very slow. Would this person be frustrated by pace and ability?
It's a great question. I've asked this question to everyone, not just to people who come from this background, not just people who haven't come from county. I think, yes, I think there will be some frustration there. I also think this person has a learned stamina for how county works. This person's seen it over the last 2 years in their volunteer work. And so they're not under rose-colored glasses of what public health is. This person's mission has always been public health. It took them to decrease maternal deaths in that hospital. It wasn't an overnight thing. It took a number of years, and that also was a slow process. I think there would be some frustration. I think anyone coming who hasn't been in a county leadership, I think there'll be some frustration. I don't see it in any way as the kind that would be like hit them in the face and after 6 months to a year say this is just not for me.
Okay, thank you.
But that's a really good observation. Do we keep going? All right. Okay. All right. Candidate 4, in some ways, there's 2 candidates who kind of stand out with what I'm about to describe. This person, the bulk of their experience has been in native healthcare, native country, as they call it. This is somebody who has also dedicated to an area where healthcare is not what it should be. The equity there is really not the same as what you might find in a county where it's with different parts of the county are not getting the same treatment. This is an entire tribe that's really does not have access to the same healthcare that others do. A lot of it because of a lack of information, a lot of it because of disinformation. But there's a number of factors that go into this as well. And so this person's I don't know that there is or isn't a county public health, but what they've told me was the biggest and best way to reform that, to get better access to people in the tribes, was through the FQHCs, federally qualified health centers. That's what this person has done for many years. Interestingly, they left after 9 years. This person's not from that area, and so in their words, they were done with that lifestyle of living in very, very remote places, not the way they grew up. So it was more like they had done sort of a mission for some time there. Loved Colorado, moved to Colorado, was in Lane County, running their FQHC and also responsible for public health there. You would know about this better than I would, but they claim that there was a political showdown. They were offered a contract for a year, or maybe it was 18 months. I'm not looking at the notes right now, but it was one contract, and somebody else came into the county and did not look like they did. It's a narrative, so I don't like to say like, but the facts are this person came into a county with education from a different institution and with different color skin, white skin, and that person railroaded this person right out. Again, it's a narrative. I'm not saying that you should go investigate and see if that's what happened, but that's the only reason this person's not still in that role. They know Boulder County. They know the makeup of Boulder County, and they know the differences they can make. That's this person's interest. I would say this is somewhat in between someone who's already done this job. They've done this job. Somewhat less of a setting, only because it's been only a year and a half, specifically in the county. The other stuff has been with the FQHCs. But somebody who has sadly experienced what it's like to do the right thing, and at least from their perspective, not be hired on based on the color of their skin. It's something that they've dedicated their career to fight, and this has only helped them fight more. I'm careful, and like I didn't write this in there because I don't want to defame anybody. The facts are true, but whether this person actually said certain lines about this person's skin color, I'm not. I can only report what was told to me. I'm sorry?
I had a question about leadership, because I couldn't really get it completely from this. So it's unclear to me, has this person led large teams or were these relatively small? And also because I noticed in the leadership answer, people who have had a lot of leadership training tend to use some, buzzy words. And this candidate did not. So I'm just curious how much leadership experience they have with a larger group.
Thank you for asking that. I'm smiling because this person told me two things about their questionnaire, which address what you just asked. You'll also notice something else about this person. I forgot to write this, but I knew I was going to mention this. When asked about the biggest challenge or the biggest crisis, the crisis management, I would say, I don't have the exact numbers, probably 8 or 9 out of 10 wrote something to do with the pandemic. This person specifically chose not to. And they told me, I don't want to be viewed for the credibility of the kind of buzzword answers that everyone's going to give. I want people to see what I did that was different than others. As far as leadership, she's overseen more than 220, I think was the highest. I asked this question just like in the interview, I just had written it down. 220 was the highest number of employees that were under them in one of their FQHCs. I don't remember which tribe it was with.
Okay, thank you.
I don't know if that's something you appreciate. I happen to appreciate, like I appreciate it when I interview and I say like, yeah, I've got somebody who didn't write about the pandemic. Why'd you do that? Because that was definitely a choice. So.
Yeah, I can totally understand not addressing the pandemic because that seems kind of easy. I was just curious more about the leadership part.
Yeah. There was, if you looked in, I thought somebody was going to ask me about this, and I'm glad he didn't, because it wasn't a sentence that made so much sense, but I'll still talk about it. You saw I wrote, they're not a typical leader and rely on hard work to achieve results. I don't know if you noticed that. I wrote that specifically as well. This was something that had come up in the interview as well. They said, I have seen the problems from the inside and I have worked them through from the bottom up. There are others who come in and look at it kind of top down and say, okay, this needs to be changed. And they work at it that way. They claim, I haven't done it that way. And I've seen more success by working it from the bottom up.
That's a good answer.
I thought I remember seeing a similar resume in the 2021 search. I don't know if it's the same person.
It's not the same person, Greg.
Okay.
Yeah.
So thank you for asking. I don't know if I hope, listen, I'm human. I can make a mistake, but I did ask anybody who's in my search. I've asked them if they were involved in the first round. I hope no one slipped through the cracks, but there was, just one second. You remind me of one candidate did say something about this. No, not about being on this search.
I think there was one, I don't know if it was 5 or 6. One of them, Oklahoma City, Tulsa. I want to say that rings a bell.
That one I do wonder whether or not, but you asked David every candidate if they had applied before. I mean, it doesn't, it's not really that relevant.
Right, it's not that important.
Yeah.
It just, I remember the thought process around screening for a finalist in 2021, and so that's why I just asked that. But and I thought that this whole issue of public knowledge of finalists affected the person in Oklahoma, and they pulled out before we were selecting the finalist, and that's why I thought about that one.
Interesting.
I think this one's different because the one, I actually do think that this person also applied last time, but we screened them out. But
Okay.
the other person would have still been the director. That person was the current executive director at that time. So I do think that this one is different from our top candidate last time who pulled out.
Okay.
I think.
Yeah, I think it was candidate 6.
Well, I guess when we get to that person, we'll talk about that person happily. That would be interesting. I wonder. I did ask everyone, but I'm human. Even though I've got
Yeah,
a team,
it's okay.
it had someone may have slipped through. And I did not hear from you that it would disqualify anyone. I would just have mentioned it. So, do we have any other questions about candidate 4? All right, let's move on. I'm sorry, I just familiarize myself with who they are for a second because I know them by their name. Okay. Candidate 5 is also someone you may be familiar with, and in some ways is a little bit of a stretch, not a stretch to, not a stretch whether they're interested or not, but one thing I noted right from the beginning, and I didn't hear it as a disqualification, but the bulk of these candidates have 2 master's degrees. A lot of them have doctorates. This candidate doesn't even have a master's degree, the only one. And part of me, there was like a self-selection, like, no, this person's not for it. I decided to entertain a few candidates who on paper didn't seem right, just to see if there's something about them. Let's not screen out everybody just based on like kind of what's written on paper. This person is on a trajectory. They're moving up. They moved up through Denver County. They have been dedicated from their entire family to public health. They have grown every four years or so into their next level. The next step in this person's career is going to be an executive director of a similar sized agency. I don't know that means let's jump on this person, but here's what it does mean. It means look at a person who brings a sense of passion, mission, know-how, and understanding to the county, knows Boulder, knows Denver, knows the surrounding area, knows some of what has been going on around here, and could be a very part of creative solutions. Of all the candidates, is the only one who I would say is going to have, everyone's going to have some learning curve, but this is the only one who might have some leadership sputtering. Like they might at the beginning, like, wait a second, how do I do this correctly? I don't say that means you shouldn't interview them. I say that means know that and see if that person makes it. I could have screened them out, like I could have screened some others out. I wanted one person who was a stretch candidate, one person who was more about hopes and dreams, and say, if we meet somewhere where they're at and their goals are to be here and we can be that bridge for them, sometimes you get the best candidate that way as well. So.
Obviously I know this person.
Okay, that makes it easier, actually. That makes it a lot easier.
Yeah, and the things I would say are the real strengths are environmental health,
Mm-hmm.
And emergency preparedness and response. I mean, this person served as the deputy public health officer during the COVID-19 response, and certainly I did not envy this person one iota in terms of the flack that even in Denver that they would take for a lot of these decisions. So, if that doesn't come through in the package, that was a huge lift, way bigger lift than I had or would have wanted in that situation. So in terms of being able to handle really challenging situations, we also have they have like residential health and housing programs, epidemiology.
Mm-hmm.
So some good chunks of the agency, they have that experience. Where I would say you're probably on things on the clinical side, things on the mental health side. That's where a part where this person would want to grow. And then, you know, some of the budgetary challenges, this person deals with, you know, budgetary challenges a little bit. You know, they have to basically claw and fight for limited resources. And so I think with the current situation and the county funding versus grant funding, this person would not be a stranger to those struggles. So anyway, I'll just leave it there.
I tried to offer them a job over 15 years ago and their boss promoted them so that she wouldn't take the job. So definitely some potential there.
I had two people. There was somebody else with a very similar background to this person who's at a system in Utah right now. In some ways impresses even more, but also is not, you know, it would still be a leap to get there. And the only, you know, this person edged out just because of their knowledge of Boulder and because their dedication to Boulder. But I did make sure that there were one or two candidates. I wanted to interview some candidates who had not yet done the job. And I think, you know, if I were on the search committee, I would want to see that as well. I think we limit ourselves when we're only looking at people who are the safe bet. Sometimes, I don't know. I shouldn't talk about football if you guys have the Broncos, but
I don't mind football, David, but just, I mean, to add some context, because I appreciate your desire to include folks who might be more of a stretch, but this is our second hire in less than 2 years. So that makes us a little more leaning into sure bets right now because we cannot afford to go through another executive director.
You can't.
You know, if we can avoid it. I understand that there's always a risk, but like, I think that, you know, we really need to have a really strong, as close to sure bet as we can.
Either. You can't afford it, but I trust that an interview can weed out more than that. So.
Yeah, no, I appreciate that. I just know that, you know, at least the board is feeling a lot of pressure to get this right.
Yeah.
To have some consistent leadership for the staff and for the community.
I did really like this one though, because they have worked directly in public health department positions. In those positions of the people that they will be overseeing as executive director. So I think of the people who have maybe less, I would put on the less direct experience side, I do feel like this person had very applicable experience because they were right in a Colorado public health department and working their way up. So that was appealing to me for this candidate. I don't know.
Sounds like those who do know him, well, it's not a him actually, but it sounds like those who do know this candidate have also been similarly impressed, right?
Yeah, and she's been really strong from a director level support, really strong on our equity, diversity, and inclusion program, and has about as good a participation from a staff level as any of our divisions, including mine. I admit I probably don't hold a candle to her in that regard.
I also just want to, you know, if this person were to continue, they've committed that if having a master's was a requirement, that they would get one. Are there any other questions? All right, you guys have me curious now about candidate number 6. I think I know who we're talking about. Yeah, okay. So this is the person that may have slipped through the cracks as somebody who may have applied a couple of years ago. It would make sense. Is there any reason for me to withhold their name then? Just
We actually never met them, did we?
No.
That's who I'm thinking. Yeah.
Why not?
I think we had 2 candidates from Oklahoma, and I think one was this one, and I think the other one was the current executive director. But whichever one was the current executive director, if it was this one, we tried to bring them in, but they didn't want their name to be public. And we were going to make them go through a very public interviewing process from the beginning. And they weren't comfortable with that because of their
I
current.
wonder if this person's deputy, because I did interview somebody else in Oklahoma who didn't feel rose to the same level from public health. I don't know, but I would be surprised if this person wouldn't want their name broadcast a year or two ago. When was it? When was this last conducted?
It's different. This was in 2021, right? 2021.
Maybe. Was that person then the dean of the school? Was that person working for the state?
The one that we really liked was, I thought, the current executive director in Oklahoma City.
I don't think in 2021 that's this person.
No, it's not this person.
No.
But I feel like this person might have applied, and we felt that this person was looking for a retirement gig, and maybe didn't. I think this is the same person looking for a retirement gig, wanted to come to Boulder and thought it would be easy. If it is this person, I don't know. Morgan, Greg, do you remember?
I don't
No,
remember
I'll
that.
go
I don't
back.
remember any of it other than the person that pulled out, and I don't think this is the same person. So I don't
This is not
remember
that person that
part of
pulled
it.
out, but if your concern is that this person is looking for a retirement gig, it's an awesome concern. That would be the one concern that I would have. Not that I actually have that concern, I will not present to them, but do you remember, was there something about their interview style and inflection that made you think that, or was it just assuming because they had such a successful career behind them?
I think it was, yes, the successful career behind them and the answers to the questions that they gave during the phone screening, which we did not do. We got the transcript, the written transcript of, and it just seems very similar to this one. Yeah.
Do you get that sense reading this now? The thing that I wrote, my note on his, there we go again, on their transcript, on their answers, was that it was written very academic. That's what I wrote. And and then associate dean. So that's why. Did you get the sense that there was looking for a soft landing? Is that what you see here?
That is only my speculation, just based on their level of experience. And the reason why I say this is because we have had people think that coming to Boulder Public Health is easy, and then it's going to be a very relaxing retirement-like position. And so it's just based on the level of experience from this person and reading through some of their answers. I wouldn't say that for sure that's what they're thinking, but I would be curious to interview them and speak to them and see if I get the impression that they think this will be a really easy, posh role.
There's no one who thinks that after talking to me, by the way. But,
okay, good. Okay, good to. Okay, that was my.
Unless they hope that I was lying to them, but there's no one who thinks that. And okay. I didn't paint a bad light. I just painted a very specifically, as it was told to me. There's a staff that has not had the right leadership in place, and there's been a misstep, and that takes a lot to fix. And there's just a lot. No one has that illusion. Let me just talk about this person for a sec. And then the one question that I think anyone would have is this person just looking to retire? And I try not to judge someone based on what they've done up until now. I try to judge based on what they answer to the questions I ask, and that you would ask them as well. This person has everything you can want in a successful public health executive director. They're smooth, they talk well, they know how to politic, they're in a very red state, and this person is not, they've disclosed this, I haven't asked them, but this person does not believe in the politics there, and has made a lot of headway in a place that was thinking differently than them. They've also had experience in a college town. There's just a lot of similarities, and other than by choice, this person does not have to go back into public health. This person could have stayed retired, could have stayed in academia, but this person has a strong devotion to public health, and they've done it all in Oklahoma, and they want to do it in a place where that they know they want to live and appreciate. This one question of, are they ready to roll up their sleeves and work really hard? I think that an interview can determine that. I wouldn't rule someone out without, giving them a really fair shot at that. Their words to me are no, they want to work really hard. And that they know. That's why I wrote about the concern. Like, do they really know how difficult it is? I think some of the questions that you'll ask on an interview would determine that.
I mean, but just based on executive director tenure, I mean, I just don't see how you could screen this person out without an interview, right? I mean, you don't have anybody with that level of experience. Now, their age, and some people are just never going to want to retire. Is there anything wrong with that? I don't think so, but anyway. And, I mean, I certainly think the politics of Boulder would be probably a welcome change of pace versus the politics of Oklahoma.
You don't have to think that. That was stated very clearly to me a few times.
I mean, in some ways, it's probably a breath of fresh air to think about doing work like that. But anyway,
this person and one of the other candidates who's in this list had the same similar comment. Also, somebody who's lived in a state that doesn't see eye to eye on their politics and has, fought a lot.
I thought their health equity questions were weak, but
Mm-hmm.
And again, I just think that this department has worked so hard and continues to really center race and health equity, and that if you don't nail that or you don't have deep experience in that area, it's going to be a really big challenge for you to lead this department. So
yeah,
I agree they have a lot of leadership, but I think that is, I foresee that being an issue. It doesn't mean that we rule out an interview, but I foresee that being an issue.
Yeah, I similarly felt the same way, Morgan. I think it was one of the last questions as far as like a biased experience that I think they gave the answer, and I don't know if it was a private situation, maybe friends potentially, where they could have come back around to have a conversation after the fact. I think they had time to reflect and didn't address it in the moment, but if it was maybe potentially a group of people that they have a relationship with, could they have had that time to reflect and come back, and what did you do to kind of repair that or have that conversation? So that was also something that I saw.
I appreciate this. So this is something I asked them on an interview. I asked them because it was, based on it was a weaker answer in the sense that almost was like, I really wish you wouldn't have asked me this question because I don't have a great answer. That's what it looked like to me. And so I asked that question. I want, I do want the board to ask and see how it's answered. But the response to me was, I've always seen equity as a bigger picture, and I feel like I came a little late in the game. I'm paraphrasing what he said, but I feel like I came a little late in the game to a specific health and racial equity, and I wish it wasn't the case, but I think the murder of George Floyd definitely pushed that national conversation more. This is me, David, talking. And he said that it was less about racial equity and more about general health equity. And that's been more my experience. And I've been out of public health since the last 2 or 3 years. Whether that's an answer you want, it was at least like I was able to ask the question because it was noted that it wasn't an aggressive answer. Everyone else like took the opportunity to like throw something out there. This was more like a reactive, like, if you're gonna ask me a question, here's my answer. But very good observation.
I appreciate him giving honest answers, or her, whatever. I appreciate honest answers too, and that they didn't try to make something up that sounds good. But it's definitely something we could push in an interview.
Correct. Okay. We have.
I mean, I know we're gonna have a separate discussion about candidates, but like, I think that we have had a problem in the past with someone saying we're working on health equity, but not understanding the centering of race. And that feels again like it could be a big potential problem.
I would ask the question though, because I didn't see that in their answer, nor did they say that to me. What they said was that was not their experience up until now. But
I am making a note, Ted. Yeah, if we interview this person, that would be
correct. I wasn't going to say this in a letter. I'll just, from what I got from the staff of what they're looking for, I don't know that a chiseled politician is the right person for some people anyway. Like maybe just be like turned off by that. So it's not necessarily fair, but that was, that may just make some people uncomfortable with this person. All right, who's number 7? Okay, number 7 is an easy one. In many ways, number 7 is exactly like the person who has done this job in a similar environment for a very, very long time. Fought very hard during COVID-19. The county in Corpus Christi and the city have a partnership with running public health. And as the response to the pandemic was getting more and more, and it was more public, this person was noticing just a differing of how the county was erring on the side of, not erring, was following evidence. The city was following politics. The city was following what people wanted. And this is not my place to judge what's right or wrong, but just two different approaches. This person's dedication has always been to evidence and will always be to evidence. And so they ended up siding with the county on most decisions, or what felt like to the public that this person was always just siding with the county. A new mayor was elected, a populist mayor, somebody who was there to stir things up. This person was let go 3 months before they were 20 years vested with the state, with the county. They were constantly told that they were siding with the county versus with the city, and that was because the evidence was with the county. They have always had an appreciation for different views in politics, but this was a little much, and ultimately wasn't their choice. Ultimately, the mayor came in, and one of the early orders of business was to shut down this what they termed as a heavy-handed public health executive director. This person is now with the state, working in Austin, not what they want to be doing. And they've also been to Colorado a number of times. Politics are a lot more aligned with Colorado. I don't know that they've experienced, no, I don't know. I don't think they've experienced the level of some of what's churning in Boulder right now, some of the challenges. And so I think there would be some challenges that they haven't yet faced. But in every other way, you know, as far as just like someone who's done this job and knows it, this person has that. They also, if we're going to compare candidate number 7 to candidate number 6, where candidate number 6 might be the safest bet as far as public health, this candidate, I don't think there are issues of how they see equity and how things center from race. Sadly, I think this person's experienced the opposite, and I don't think that would be an issue.
Can I ask just an impression question?
Mhm.
I mean, on paper, this candidate seems amazing. Were you equally impressed when you spoke with them? Or do you think the paper's like overstating this candidate?
That is a great question. But before I even answer your question, I want to say something. You have no idea how many people were on my list. I mean, Chris knows. Like there were people like this person is for sure getting presented. Just you know, put them in, whose papers, like I was convinced was the right person, and then they talked themselves out. So it's a great observation. Really good. This person met exactly what the paper tells me, meaning they were the same energy, the right confidence, a calm but understanding presence. I will say this person didn't wow me more than the paper. This person didn't say, I didn't get off the phone and say, oh my God. I said this person is exactly what their resume and their questionnaire was.
Okay, but that's pretty good. So I can.
It's good, but the only reason I smiled is because there was a part of me that was wondering, is this person gonna, like, sometimes the interview takes them up, sometimes it takes them down, and sometimes it kind of keeps them where they're at. This person kept them where they were at. So I was wondering how you would know that, like, because you weren't in my brain, but interesting that you asked it.
Okay, thank you.
Do we need to go through candidate number 8?
I'm interested in your observations.
Yeah, I guess just your general observation.
So I was under what is probably a false impression. I don't know where I got this from. I really don't. Somewhere along the way, it was communicated to me that this person was not a candidate, and I don't know why. And I don't know if that's even true. And so I almost did this out of a courtesy initially. So that may have colored, and my boss always tells me I don't have to share everything, but I just did. That may have colored a little bit about how I interviewed. There were two things that stood out to me, and they're almost like bipolar, you know, like there's just two extremes. On the one hand, this person knows the county, knows what's going on, knows everything. I don't think you have somebody who's as prepared to walk in. There's no one can be as prepared. My two things I noted though. One is I don't know how easy it will be for this person to go from one of the staff, even at a deputy, to the executive director. I heard specific things in our interview about how this was not done for the staff. And that doesn't mean that I don't know that it was a judgment, but I think going from I hope you don't see it, nor does any good leadership see it as an us versus them, but a leadership matrix does require a certain sense of authority and autonomy. And that would be, I think, a challenge. Might be one challenge. The other thing is what I wrote. I was surprised.
Sorry, David, before I'm sorry to interrupt you. What what was the comment? This was not done for the staff? What does that mean?
She said something about how the staff I remember asking, I made a comment about how this either Boulder County is an envious place to work. Something very positive, and she said, "Well, I don't know that all the staff feel that way."
No.
And I
Okay.
thought that, and that was honest,
Yep.
which is great.
Yeah.
I will tell you that I've had leaders who, even if they know the staff doesn't feel that way, there's a positive way to say that same thing. Even if it's that same message that staff have not been getting or feeling that you could still say it with a positive spin versus we feel they deserve more spin. It's a small sense, but I share it.
It's been a bumpy couple of years. It's been a bumpy couple of years.
And David, also, David, I think some of your perceptions are spot on, because we do know that there have been struggles with the move from peer to manager in some of these situations, and so that is some of the feedback that we've gotten.
Wow. Okay. Well, that is, I guess, part of my job. But yes, that was. It's a sense. It doesn't count somebody out, but it's a sense to be concerned with. And I can tell you that whenever I'm called for a recruit, if there's a challenge in leadership, it's a tough line to walk. Which brings me to the second point, and I wrote this. There's a lot of idealism and a lot of advocacy, and I think if I wanted someone in my corner who is going to help change the world, and even if it started in a small county of Boulder, this is who I want in my corner. This person understands it, gets it, knows where the solutions should be, knows how to start making changes. Do I see that as the same person who is enacting them? I don't know. I see this more as a mission of a global mission. And I don't know if in the day-to-day practical leadership, if I see the same strengths. So everyone else that I've presented thus far has come from a position of, I want to work on public health. I want to work on health inequities. I want to work on giving people better access. And I've kind of done step by step to get there. This person's come from a very different angle. This person's come from, I think this has to happen, and I've helped it in this way. I've helped it in this way. This is the first role where she served in this kind of role as just in county public health. Again, similar to what we said with candidate number 5, if I'm correct remembering, this doesn't mean this person is disqualified. It doesn't. It's just important to know when interviewing what we're looking for.
Yeah, I think those are all great observations. Thank you.
I said this in my letter. One of the most difficult things for me was ruling out some other people. These people, to me, represent the top of some very good candidates. If, God forbid, all these people would no longer be available, there's literally like backups for each one of them. But these are the better ones. And so, if there's something that you feel looking at these candidates like, hey, some of these are just off base, I hope that's not the case. But if you feel that, I hope you'll tell me. My hope, I'm not in charge of your time. If you have 8 hours and you can work 8 hours in and want to interview all 8, that's great. But you're kind of kicking the can down the road. You're going to have to make a decision that some of these are not going to make it to the top. And so I hope it's going to be a consensus versus everyone agreeing on the same thing, because that would mean, I don't know, either I did something wrong or you're not all thinking. But I would hope that there's, some discussion, and some people want to see certain people and some don't. But if we can kind of get it down a little bit to 6, I think it'll make the subsequent decisions easier.
David, just a quick question. Was there any candidates that weren't considered that actually were public health directors at a local health department or had been?
In Colorado?
Anywhere in the state,
Yes.
In the country?
Yes.
They just didn't have the other experience that went along with it?
They either I'm not sure what I'm not going to remember everyone on the top of my head what took them out. Like, let's say, for example, a candidate number 2, for example, who has that experience. If there was somebody who who was what I sensed lazy, like somebody who, when I asked their motivations, and it was like, well, I've been doing this, I can keep doing this. Some people were a little bland, and it's not fair to take somebody from bland personality. And I don't rule somebody out because of a bland personality, but I don't see somebody coming into this role without a fire for like a really strong desire to do something more versus just like, I've done this, I can do it again. I also did, and this is, I got this sense very strongly. I really tried to keep this an equitable pool. And so the facts on the ground are that white men are the more common public health directors in our country. And so if that was going to tip the pot and it was going to be just the same of those, I might have looked for more diverse experience as well. I think you have enough people with that experience that if that's what you need, you have.
Yeah, thanks, David. I mean, I feel like this is a good, strong pool of candidates and appreciate the work that you and your team did to sort through and recruit.
Yeah, they're not on the call to get the credit, but it's my team. I do the interviews, but they really do a lot of the background work.
Yeah, no, I appreciate the work that went into this, and yeah, and I think we have a good pool of candidates, and I think that we can get it down to like 5 or so for interviews.
That'd be great.
Yeah.
I don't remember. I know Catherine and I have been through this, but my thought was we do a Zoom and then I would hope we could bring in 3. If all 3 are local.
Oh, for finalists, you mean?
Yeah.
Yeah, I mean, I think we had talked about having 2 to 3 finalists.
Okay.
2 to 3.
That's fine.
Yeah.
I will tell you.
But at what stage of the game does that determine, Morgan? Is that after another round of interviews?
Yeah, after. So, yep, the subcommittee and the board will weigh in on who to do Zoom interviews with. So that would be down to like 5 or 6 or 4 to 6, something like that. And then from there, the subcommittee would decide the 2 to 3 finalists to bring in person.
That's good. I will tell you, the only difference to me between 2 to 3 is from just knowing from the candidate side. If the 2 that you want to bring on are, 100% in, then I would say we don't need to bring 3. If 2 of those are like, I don't know that they're for sure in, like, let's say both of them are not local, you never know what can happen. You just don't know. They could visit Boulder and decide it's too expensive. There's certain things can happen. So that was where I would encourage 3. It's really just a kind of a numbers game at that point. There was one other question I had about this. All right, happens. I remember. I really appreciate your time. I know that you're all volunteers, and I serve a volunteer one board, and if they made me come in on a Wednesday afternoon, I'd probably resign the next day. So I really appreciate your time.
You wouldn't make it very long on this committee, I'll say that.
No, I wouldn't.
All right. Well, are there any other questions that folks have for David while we have you? And David, I mean, I assume that if we have other follow-up questions after our group discussion, that we can circle back and ask you for that. Yeah, great.
You can. I'm away on Thursday and Friday, so please, as you always should, copy Chris, because if it's something that needs an immediate answer, he'll get the answer or he'll call my boss, Laura. And make sure it gets responded to. One other thing, not that I expect this would happen, you don't even know the names yet, but if there's somebody that we rule out, I just, as a recruiter, unless it's something specific, like we do not like this person for this reason, I don't rule them fully out. You just never know, things shift. Sometimes one person who we thought was the best falls I promise you that happened in this interview process. Some of the people I thought were the best candidate, I didn't even present. My first candidate, who I thought was for sure going to go, he's local, lives here and lives in Boulder County. I was not impressed. So I don't know. Egos don't do well for me, and this person talked too much about themselves and less about public health. So
That was probably good instinct for this department.
I don't think so.
Yeah, thank you, David.
Of
This is
course.
much
Yeah,
appreciated.
thanks.
Thank you for your time, everybody.
Thank you very
Have a
much.
great rest of the
Yeah.
week.
Thank you.
Bye.
Hey, Morgan,
Hey, yeah, Joe.
I was just looking at the time, the timeline. I'm a little bit confused on the interview process because so, we had the presentation today,
Yeah,
and by the 10th, the Board of Health is to lead initial selection to ensure finalists have full support of Board of Health.
yeah,
So that means the full Board of Health will review this
that's
group?
right. Yeah, the full Board of Health with you and Elia. Yeah.
And then that group will narrow it down to 2 or 3?
No, that group will narrow it down to the 4 to 6 that we want to do Zoom interviews with. But the full board is not doing those Zoom interviews, just our subcommittee is doing Zoom interviews.
To avoid the public
So that must be
notice.
on the 17th. We're supposed to do Board of Health DM reps to participate in interviews?
Those are those time, yeah, the time blocks that we blocked off for interview times.
Okay.
Yeah, so those interviews will take place, I think, on the 17th and 18th is when we blocked off those times. And we just
For the Zoom interviews or
for the Zoom
regular?
interviews, yeah.
Okay, then we just need to update the timeline. It's just not showing that second interview. It only shows one interview.
I haven't looked at the updated timeline from Jordan, but yeah, we're doing those Zoom interviews and then our subcommittee will discuss those Zoom interviews and pick 2 to 3 finalists to come into town. So we, as a subcommittee, we won't do finalist interviews. That will be the board making, meeting with the person, the DMs meeting with the person, and the full staff town halls. Does that clarify the process?
I think I was just trying to, do you see the timeline?
I'm looking at your
Yes.
screen here. Uh-huh.
So you got the 18th is the select 2 to 3 finalists. So the Zoom meeting must be taking place.
Yeah, so we are trying to do 4 to 6 Zoom interviews over 2 days and then decide the 2 to 3 finalists right at the end of those.
Okay,
At the
17th
end
and
of-
18th are Zoom interviews.
17th and 18th are Zoom interviews, followed by our subcommittee, like coming right out of those Zoom interviews and saying, these are our 2 to 3 finalists.
And
So
then we
that
need to
they
schedule
can,
another interview. Okay.
well, to invite them in for the tour, the in-person tour. So no more interviews for our subcommittee after we complete our Zoom interviews.
That's what I was thinking. Okay.
Just the
Yeah.
town hall.
Yeah, the town hall and then the Board of Health meeting and the DM meetings, that's all part of their tour.
I did want to bring up the DM meeting with the it leaves out the other associate directors, Kelly and Kevlin. So I think we should
Oh.
just maybe make it a management team,
Yeah, that's great.
Why would
Yeah.
why would it leave them out, Joe?
because they're not division managers.
It's DM, but we talked about this like 3 or 4 weeks ago that it would include the entire management team.
Okay, good. I just wanted to make sure it wasn't in the timeline. So good. I know Kelly sent me an email and just asked. I wasn't sure. So
Oh, yeah.
good.
The intention is to have them there. Yeah.
Okay.
And yeah, I mean, I think given that we have, given that we only have those 2 days and we only have like 5 blocked off hours for interviews or something, I think we just need to really narrow down this list of 8 to get us to our, 4 to 5 would be, I think. And I feel like there are 4 to 5 for me that rise up. I don't know how you all feel about that, but out of these 8, I feel like
For
it's doable.
clarification, Morgan,
Yeah.
I understand that Lindy and Landry will also be looking at the packets. Is it the case that they will be providing feedback on?
Yes.
Okay.
Yeah,
Okay.
yeah. So they'll have the opportunity to review the session right now with David's comments, so they can sort of hear the context. They'll review the packets, and then on the 10th, that afternoon, we will go through as a group and try to coalesce around 4 to 5 people to interview via Zoom.
Okay, so the only other question I have is that we had scheduled a time at 1:30, I think, to follow up. Do we want to take that off the calendar or do we want to keep that?
Yeah, I think I'm sorry that I missed last week's meeting because I was on spring break. So I don't know if you all decided that there's anything that needs to be discussed today before we meet on the 10th.
I don't
You're
think
on
so,
mute,
Joe.
Joe.
Yeah, Joe, you're on mute.
It would give me some time to take another look at the candidates.
Yeah, me too. Okay, if there's nothing that you all need to, sorry.
When they go, the
Yeah.
questions, when are those due, Catherine? The revised, or did we have to?
I think
the
I'll go
10th?
back and check, Elia, but yeah, I think it was the 10th that I asked you all if you could submit the interview questions to me, so that I can prep those to go out to the candidates you select.
Yeah, you're
Does
right,
that mean
Elliot.
we have,
That's
oh yeah, that's Monday's the 10th. Yeah, so I was thinking
Yeah.
maybe we had another meeting, but no, that's already
no,
Monday.
we do need to finalize those questions. I mean, I had, until noon blocked off right now but we've lost Brooke. Is that right? Brooke's gone.
Just plan on 1:30 then?
Yeah, we might have to take these next free 20 minutes, look through the candidate packets again, and then see if we can just bust out those questions at 1:30.
And then the board meets before the board meeting next week, I assume, to kind of do the similar exercise that we just did.
Well, so the board, and I believe that Elia and Joe, you are joining us, right, at 3:30 on Monday. Yeah. So Greg, it's not that, I mean, we're not gonna like watch
It's
the
not with
presentation.
David.
No, we're just gonna like dive in and go through our own matrices to try to whittle those candidates down.
So all of the board members should be reviewing the packets and doing the matrix scoring.
Yep.
Okay. Good to know.
And
Thank you.
it's a good question, Greg. I don't know if that was not clear to the rest of the board, then we probably need to just be very clear that that's the expectation coming into Monday's meeting, that they're going to be filling out the matrix and going through those.
It never hurts to over communicate.
Yeah.
And the best use of that 2 hours is going to be to have filled out your matrix so you can kind of, I want to make sure I bring this up or something like that. Okay, good.
Yep. I'll send a note to the rest of the board and just clarify that's what the expectation is.
All right, cool.
All right.
Okay, so we're keeping the meeting on the books for 1:30.
Yeah, just so we can get those questions hammered out.
Okay, I may not be there because my battery is dying on my laptop and my charger is not working. So, but I will have Jordan be there if I'm not able to attend.
Okay, that sounds good. And appreciate you setting this up with David today, Catherine.
Yeah. All right. If there's anything else you need, let us know.
All right, sounds good. See ya.
Bye.
I have a dentist appointment right at 12:30, so I may be a couple minutes late, but I plan on being at 1:30.
Okay.
With a shiny smile.
Yeah, thanks.
All right, thanks.
Bye.